I am Dr. Yash Kumar, the Director of the Vein Center of Maryland. Do you have pain and swelling in your legs, leg heaviness, fatigue or cramping, itching and burning, varicose veins or leg ulcers? If so, you may have superficial venous reflux disease. Symptoms will worsen over time if left untreated. We offer procedures which are minimally invasive, including endovenous laser ablation, radiofrequency ablation, and microinjection sclerotherapy. The ablation procedures and microinjection sclerotherapy normally result in good cosmetic outcome with minimal to no scarring, bruising, or swelling. Here at the Vein Center of Maryland, we can significantly improve the appearance of your legs by eliminating bulging, painful, and unsightly veins. The first step is a consultation visit with our experienced physicians. Healthy leg veins contain valves that open and close to assist return of blood to the heart. Venous reflux disease develops when the valves that keep the blood flowing out of the leg and back to the heart become damaged or diseased. As a result, vein valves will not close properly, leading to the symptoms of pain and swelling, leg heaviness, fatigue and cramping at night, itching and burning, varicose veins, skin changes and leg ulcers, as well as restless legs.
What it's like having varicose veins at the young age that I had them is like being an old lady before your time. You get tired easily, you have a lot of pain, your range of motion is somewhat limited. My legs were swollen.
The symptoms I experienced were pain in my right thigh, some muscle cramping, and bulging veins in my shin and calf. It was really bad.
Until recently, one of the only options in the treatment for varicose veins was a process called stripping and ligation. During vein stripping, multiple incisions are made and a stripper tool is threaded through to pull the vein out of the leg. With the ablation procedures, only one small puncture is made at the insertion site. The laser fiber or the radiofrequency catheter is passed through and the vein is ablated by these methods. This minimally invasive approach eliminates pain and bruising associated with vein surgery. The recovery time for this minimally invasive procedure is very short. Typically, patients are walking immediately following the procedure and resume non-strenuous activities right away. Patients also report feeling little, if any, pain during and after the procedure.
My experience with the closure procedure was exactly like my physicians told me it would be, every step of the way.
The closure procedure was very comfortable for me.
There was no pain, no throbbing, no numbness, none of the things that they said might happen. Nothing. I felt perfectly fine. I mean, I was ready to get out of bed and walk out of there.
Spider veins are a type of varicose veins. They are small, dilated blood vessels near the surface of the skin. They can develop anywhere in the body, including the legs, specifically on the upper thigh, below the knee joint, and around the ankles. While many people think that varicose veins are simply a cosmetic issue, there is in fact often an underlying medical problem that causes the varicose veins. The medical condition is called venous reflux disease. The Vein Center of Maryland specializes in the treatment of venous reflux disease. We perform corrective procedures which are minimally invasive, including endovenous laser ablation, radiofrequency ablation, and microinjection sclerotherapy. Sclerotherapy, which takes its name from the Greek word meaning hardening, is a method of treating enlarged veins by injecting a medication called the sclerosing agent into the vein. The substance causes the vein to become inflamed, which leads to the formation of fibrous tissue and closing of the lumen or the central channel of the vein. The first step in treating your condition is a consultation visit with our experienced physicians. We will thoroughly evaluate your leg veins using duplex ultrasound to diagnose the specific venous disease. The ultrasound will also inform us as to which method of treatment would be most effective for your individual case. The physician will discuss your candidacy for the laser ablation as well as other treatment options. The recommended course of treatment will be based on your particular venous disease. So let's review the benefits of endovenous ablation procedures. They are the relief of the symptoms, the convenience of an outpatient procedure. Often this procedure can be performed under local anesthesia, the resumption of normal activities, typically immediately, a good cosmetic outcome with minimal or no scarring, bruising, or swelling. The majority of these procedures are covered by most healthcare plans. If you are experiencing any one of these symptoms, please call the Vein Center of Maryland today to schedule an appointment and get started on the path to healing.